Hi there, so you want to get into medical school? Great choice. Well, I've been practicing medicine for more than 25 years and I'm a graduate of the Albert Einstein College of Medicine, one of the best medical schools in all of these United States. In this video, I'm going to be talking about how you get into medical school and what happens after you get into medical school. Stay tuned, I'll be right back. Welcome back. My name is Dr. D. Terrence Foster. Now, the motivation to do this video came about because I did a career event for one of the high school I attended in Jamaica. Now, so many people have considered the idea of the thought of going to medical school, and sometimes this came from just maybe as a person you've been to the doctor for a condition, for treatment, checkup, or whatever, or probably you know a doctor, you've seen a doctor in television or somewhere along the way, and you've decided you want to be just like that doctor. So you probably want to go into medical school because you've been encouraged by a family member. It could be a brother, your sister, or cousin, or maybe a friend, or maybe you yourself do not wish to go to medical school, or probably it's too late for you to go to medical school, but you have the desire to see a family member, someone you know or care about getting into medical school. So this video will also provide some information about how the process works and what you could do to help that person get into medical school. In addition to talking about medical doctors in general, I will also talk about careers that other doctors do, and these are not necessarily medical doctors, but I'll talk about that closer to the end of this video as well. And the big question, of course, is how do you get into medical school? What do you have to do? Now, the process is essentially very similar regardless of the school that you attend. Regardless of where you are in the world, the process is essentially the same for most medical schools. So we're going to start by looking at the University of the West Indies in Kingston, Jamaica, about their process and how, in part, some of the requirements for getting into medical school there. The Faculty of Medical Sciences at the University of the West Indies has established certain minimum criteria for admission to their medical school. Now, with respect to age, you must be at least 18 years of age at the time of admission. You must have passed at least 5 CXC exams subjects. CXC is Caribbean Examination Council, or also referred to as CSEC, which is Caribbean Secondary Education Certification, or its equivalent GC, which is General Certificate of Education, or O levels. Now, these are the subjects that used to be administered many years in Jamaica, not so long ago. Now, O level examination are equivalent to CSEC examination, or replace CSEC examination. Now, the 5 subjects that must be passed or must be included in the number of subjects that you pass, at least 5, should be English, biology, chemistry, mathematics, and physics. In addition to those 5 subjects, you must pass 2 units of biology, chemistry, and 1 other 2-unit CAPE. Now, CAPE is Caribbean Advanced Proficiency Examination, or its equivalent, the A-level subjects. Now, this is a General Certificate of Education subject, which has been replaced by CAPE. The third requirement with respect to academic is that you must have a degree, a basic science degree, which should have biology and chemistry as part of its major credits. Now, in addition to academic, there are other requirements as well that you have to meet. Now, these are also very essential. One is that you must write at least a 300 words autobiographical description of why you want to go to medical school. It is good that you want to go to medical school, but you must tell the admission committee why you want to go to medical school, why you want to get into a career of medicine. So it's very important. Some school will have 300, some will have 400 to 500 words, but this is something that you have to do in most admission to medical school. Now, the next thing that is also very important to a lot of medical school is that you must be involved in some extracurricular activity in order for you to be considered eligible for admission to their school. Now, this is not the case in all schools, but most schools require that. And extracurricular activity in this case could be in socially oriented or community volunteer services. Now, let's say, for example, you are, well, most of you who are interested are probably going to high school. So are you a part of the student council? Or are you a member of some club in your high school? Or if you're not, then guess what? You could create a club in your high school. It could be a photography club, it could be a chess club, or it could be a club that will also show and become part of your evaluation process once you're going to medical school. Now, with respect to community, maybe you attend a church. Now, that could become a very important part of the process of your admission, because maybe you could join the leadership team of your church. Now you're saying, well, you're so small, you don't know what's going on. But yes, you could probably start off by assisting in Sunday school, becoming a Sunday school teacher, probably taking over the kindergarten kids and teaching them about whatever your church is teaching them. You could become a part of that as well. You could also be a volunteer, let's say an alumni body. Alumni usually visit the school, alumni group. And when they do, they usually have certain functions that are going on. Get involved in those functions. And when you go there, let them know that you're there. So don't just show up and nobody knows that you're there. But make sure you meet the president or whoever's putting it. Talk to them. Let them know that you're there and be a part of the service that they're providing. So be an active part in your school, in your community, so that this will be very helpful once you're ready to write or to validate all the services that you have done. Now, for parents and relatives and friends out there, help the ones that you want to get into medical school to formulate things that they can do in their community, in their school, so that they become better equipped to be admitted to medical school. It's very important. It could be getting involved in the 4-H club, Boy Scout, Girl Scout, any sort of leadership role where they could become an active part. That will be very important, will be instrumental in helping them to go to medical school. In addition to that, there is also foundation. A foundation is a body that's usually formed to be of some charitable benefit to the community. So maybe in their community there's a foundation that they could be a part of, volunteering to feed the homeless, volunteering to battered women shelter. There's just so many things that are out there, but let that be a part of their preparation to go to medical school. Now, in other places like the United States, of course, the academic process or the admission process is still very similar. Now, in a lot of places, instead of Bachelor of Medicine and Bachelor of Surgery, that is MB and BS, and a MD degree, medical doctor degree, or Doctor of Osteopathic Medicine, DO, is awarded once you've completed medical school. The admission process is very similar. Now, in the United States, for example, you are expected to have a minimum, at the time of admission to medical school, most medical school, a bachelor degree. Now, it will include some similar science subjects like biology and chemistry as well. And each school will have a different admission criteria, but they will be very similar. Science will be a very important. Science and mathematics are usually the core foundation of most medical school. Science, including biology, chemistry, physics, these subjects will help you get into medical school. Now, in addition to that, there's also a standardized admission test which is called the Medical College Admission Test, the MCAT. Now, some schools use this as a barometer to admitting students into their program, while others don't. They place more emphasis on academic performance and your extracurricular activity. But in most instances, it's required, and you'd be expected to have a good to excellent MCAT score at the time when you're submitting your application to medical school. So the process is very similar. The process is different even within the same state. In the United States, for example, different school in the same state will have slightly different admission criteria, even though in general they're very much the same. The same, in essence, the same subject that get you into one school, or the same qualification that get you into one school, will get you into most other schools in general. In the United States, for example, the Doctor of Medicine degree is offered by about 158 medical schools, while the Doctor of Osteopathic Medicine is offered by about 38 Doctor of Osteopathic Medical Schools. Although there's a minimum requirement, the minimum requirement will get almost no one into medical school, because you are literally competing against your fellow students. And in general, these are students who are at the top of their school, or close to the top, maybe the first one to five student, or the top five student probably, let's say for example, maybe trying to get into medical school. So if you have 100 high school in your country or in your state, or 50, whatever the number of high school, you may have the top five or the top three or two, the top one or two students trying to get into medical school. So the students that are coming, they're coming with excellent grade. They're coming prepared. They've done their homework. They've been working for this. So when you're preparing and when you're getting ready to go to medical school, when you're ready to submit your application, you should have an excellent application ready to be submitted. How are you going to get that? You have to ensure that you're not thinking about the minimum grade or the minimum requirement, but you're thinking about how you're going to do better than the person who is in another high school across town from you. You're going to make sure that your application is better than theirs, because they're going to be doing everything to ensure that their application is top notch, so that once they present their application and the admission committees across the country are looking at their application and yours, they want theirs to be better. So you got to work really hard. So grade point average, you want it to be as close to 4 as possible. In some cases, if your subjects are 1, then you want your grade point average to be close to the 1s as possible. But whatever your grade point average, it must be close to the maximum grade that you could get once you average those out. Regardless of wherever you're coming from, whichever school you attend, you must have excellent grade in order to get in. There's just about no shortcut in getting into medical school. In some instances, if you're there waiting, trying to get into medical school, do a master's degree, do some other degrees that will enhance. And in addition to, before you even get to that point where you want to get into medical school, make sure that also you spend some time with someone who is in the medical field, preferably a doctor, or you could shadow them. You could go to their office for as much time as they will allow you to spend in their office, so you could see what it is you're trying to get into. So you don't just apply to medical school and say, oh, I think I'm gonna like that, and then find out at the end of it, after you've spent a year, 2 years, or 4 years, that this is something that you totally do not like and do not want to be a part of. So make sure that you find a mentor, a guide, or somebody who will allow you to spend some time in their office, shadowing them, spending on maybe during your summer, during your whatever time you could get, whatever time they will allow you to be in their office. Take that time to go in their office and spend some time. And this is not only applicable to medical school, but whatever profession you're interested in going into, try to find someone who is actually doing or practicing in that profession or that job or whatever it is you're trying to get into. Try to find someone who is doing it and spend some time with them, and parents, relatives, friends, whoever you are in charge of, try to get them to find someone who they could spend some time with, so that they will know exactly what is it they're thinking about, and then they could decide, really, do I want to do this? I don't think so. Do I like blood? I don't like blood. Do I like to have an office like what this person is work under the condition that they're working? Probably once they see those things, they will either like what it is they're trying to get into, or it may at least give them a better perspective and allow them to make a more informed choice. Now, another good source of information if you are planning to go to medical school is there times when you'll see past students, they'll come to your school, or sometime career week, you see all these people come to your school and they're loaded with information. It's a prime time for you to try to get as much as you can out of them. Make sure that you pay attention to those events and be a part of it where you can, because you will get a lot of information. They have the experience, they know, and they also will be, a possible chance for you to try to get to know what they're doing, get their information, because you may be able to spend some time in their office where possible. Because again, it is very important that you know what you're getting into, and you don't just like something because it looks good, but you want to at least get some practical event or see the practical side of it. Because when you go to someone's office, you're not likely to be doing anything other than standing and walking around and watching. And depending on the office, of course, and depending on what it is, but generally there's not a lot of involvement at this stage anyway. Later on, when you get older and you get more into it and you're more advanced and you're sure about what you're going into, then chances are there'll be certain protocol or certain terms or condition that can be established where you could be a part of what they're doing and get your feet wet, so to speak. But initially, don't expect to going in and to be doing anything other than being a good observer. Now, for the most part, what's going to happen when you get into medical school, you'll see that depending on where you attend medical school, your school will probably, the duration of the time that you'll spend in school will be from 4 years to 6 years. It's somewhere closer to 4 years in most instances. Some schools are 5 years, some are 6, but most schools are about 4 years that you'll spend. Now, the first 2 to 3 years are generally considered to be the most difficult years for most medical students. And why is that? The reason is very simple. When you get into medical school, you will be experiencing a very large volume of work. You'll be doing stuff like biochemistry, you'll be doing stuff like histology, cell biology, some stuff that are considered basic medical sciences. And once you're doing these subjects, what often happens is that you'll attend a class and the professor or the lecturer will do a few lectures, but then once they finish that, they'll be taking that from one or more books. And guess what? You will be required to go and finish the lecture, finish those books. Now, this is not just happening with one lecturer or one professor, but there's several. You're getting maybe about 3 or 4. You'll be doing maybe 3 or 4 courses at the same time. So you'll be doing all these different courses, and at the end, you're expected to go and read maybe 3 or 4 or 6 books. And this usually occurs over maybe about, most courses will probably run for maybe about 6 to 8 weeks, 10 weeks, depending on the courses that you're taking. Some courses are very long. It could be a month, 2 months, or maybe 8 weeks, 10 weeks, depending on the courses. The length will vary, and the school that is giving each courses will have a different time frame for how long their course runs. Now, what will happen is that you'll have this very large volume of information to assimilate, to learn, and also to prepare for examination that is coming up right after each course and during the time that you're taking the course. Now, if each person were given enough time to do all the work, to study, to learn, and take as long as they want, then almost everyone could be a medical doctor because they have all the time to study the information. Unfortunately, that is not the case. So what does that mean? It means that if you're in medical school, it's a totally and completely different level of commitment than when you're in college, even at a very high level in college. You will have to be very focused. You will have to spend a lot of time. You'll have to organize your time appropriately so that you do not waste time, because your time is very limited. You don't have a lot of time to go and do a lot of extracurricular activity then, or to do a lot of things that are outside of the scope of medicine. Now, that doesn't mean that you will not find time to go to the movie, go visit your family, and do all those things, or call a friend. Or you will still have time, but your time will be limited. Now, if you're not able to manage your time efficiently and also be focused and to spend quality time studying, then you are going to have problem in medical school. It doesn't matter how smart you are or how smart you've been. It's not so much about the difficulty of the type of work that you're doing, but rather it's the volume of work that's going to make the difference. It's going to be a matter of how well you could understand and reproduce some of these information. That is going to be a very large volume of material that you have to reproduce and to be ready to be examined on these and this material. Because if you're not ready, or if you cannot produce this material, then you're not going to do well in medical school. But here's the good news. Now, once you get into medical school, there's a very good chance that you are going to come out with a medical degree. Now, the admission committee of almost all the school that you are likely to get into or admitted to, they have taken a great effort, and it's really important to them that the people that they admit to medical school actually graduate. They don't want to look bad. They don't want to take a student in there that end up not doing well. So if you get in, you are likely to graduate with a medical degree. So that's a good news. And when you're in medical school, you will find also that the student there, as I said, they're all coming from, they're all top in their school that they used to attend. You know, for example, if you're in your college school, you know, the professor might ask a question, and maybe 10% or 15% of the class may know the answer to that question. When you're in medical school, and generally, if one or two people know the answer, probably about 80 to 90% of the entire class, if not the entire 100% of the class, will know what they're talking about, because everybody there is at a very high level. So once you get there, you may even find that you're not the brightest person in the class anymore. You may be somewhere in the middle, or somewhere to the top, or maybe even down at the bottom. But you know, you will all be doing well, and once you get in, chances are you're gonna get out, and you're gonna do well. You're gonna get out, and you have an excellent chance of doing well once you get out. So that is the first 2 to 3 years of medical school. What happens after that? Once you've completed what is called the didactic year, or the years when you're just learning basic sciences, now you're ready for the clinical years of medical school. What are the clinical years? Now these are years when you are essentially going to be working like you are a doctor. You'll be given your own patients, and you will be supervised by either a very fully trained medical doctor or someone who just has more experience than you. This could be an intern or a resident physician, and I'll explain what that is in a second. So once you are going through these clinical rotation, you're going to be exposed to, for example, internal medicines. You're going to be exposed to family medicine, OBGYN, psychiatry, physical medicine rehabilitation, orthopedic specialty. You're going to be exposed to dermatology. You're going to be exposed to all these different specialties that you've heard about. And you'll be spending anywhere from 2 weeks to sometime 10 weeks, depending on the subject. You may spend, for example, in pediatrics, you may spend 4 weeks. In internal medicine, which is a very big subject, you may spend 12 weeks. Or in OBGYN, you may spend 8 weeks or 6 weeks, depending on the program. Whereas in dermatology, you may spend 2 weeks, but you will get a chance to be exposed or experience what these specialties are. And you'll do that for about 2 to 3 years, depending on the length of your program. Now, before you get to the end of medical school, where you've completed those 2 to 3 years, during the time that you're going through these rotation, it will give you an opportunity for you to figure out what is it you want to do. Do you want to become a pediatrician? Do you want to become a psychiatrist? Do you want to become a cardiologist? What do you want to become? And once you figure that out, you will, before you leave medical school, you will go through a process that is called the match that is within the school. You don't have to worry about that now. And then you will have chosen a school or a residency program, or a place where you want to go and continue your medical education after you graduated medical school. This is the second part of your medical school training, where you have to go through the clinical years and then literally determine what is it you want to do. And once you finish that, you have completed medical school, and now you're ready to graduate. So you get your graduation day come, You graduate, you walk on the stage and you get your certificate and you're happy about it. You walk, you go, you collect it, you hold it in the air and you move and you're ready to go. And now you are an unqualified medical doctor. You're a doctor unqualified. Well, it's time for internship. What is internship? Now, you're working now as a doctor. You've graduated medical school and now you are a doctor, but still you're, as I said, you're an unqualified doctor. You still need to be under the supervision of another doctor. And usually that's the fully trained doctor who is responsible to making sure that you do the things that you're supposed to do. Now, internship typically lasts for about 1 or 2 years in general in most instances. And during this time, you'll be learning probably more internal medicine, or it could be a collection of things, almost like another year of clerkship in some instances, or it could be general surgery. It depends on the program. There's so many programs that are out there for internship, and some people call it house officer, that are out there that you will go through and you will spend another 1 to 2 years, depending on where the program is, your medical school, you will go through that. And once you finish that, you're still not ready to practice and go out and earn the big money, which some people believe, which is not necessarily true. There's no more big money in medicine. So if you're going into medicine because of money or because you think you're going to become rich or something, that is not true. That probably was the case many years ago, but definitely not today. You don't become rich by being a medical doctor. So you finish your internship and you're ready to go to the next level. And the next level is now you're ready to become a real doctor, and you're going to specialize now in the area of your choice. So now this is the time when you're going to be specializing in whether it be pediatrics, OBGYN, physical medicine rehabilitation, internal medicine, psychiatry, neurology, whatever it is, orthopedic, general surgery. These next few years when you're going into a program which is called residency, that's the time when you're gonna go and you're gonna start doing this. Now, residency could last from anywhere from 3 years to about 7 years. And while you're going through that, you're still gonna have, you're gonna be working primarily as a doctor. You'll have your own patient. You will literally be feeling like a doctor. These, for the most part, will be, and actually, here's another thing about when you're in residency, you'll actually be paid while you're in residency and also while you're in the internship. So you're making some money, nothing close to what you're making as a fully trained doctor, but you'll be paid. So at least it's not necessarily free labor. You'll be paid, but enough for you to much more than what you're making before as a medical student, which was nothing, but you'll be paid something. So you go through the process of residency and you finish. And then once you finish those 3 to 7 years or however much time you want to spend, depending on the residency program you go into, then you are ready to go out and work. But here's another option. Once you finish your residency, there's some doctors who decided, well, I need to do more than this. This won't get me to where I want to go to. I got to specialize more. So you could do what is called a fellowship. Now, a fellowship could be further training in the area of your specialization. So you become more specialized. For example, let's say you want to be a cardiologist. Now, for you to become a cardiologist, you still have to go through internship. You still have to go through internship of internal medicine. Then you have to go through what is called a cardiology fellowship. But after you finish that fellowship of cardiology training, at best, you're going to be a general cardiologist. But what if you want to become an interventional cardiologist? Then you have to go through another fellowship. You could call it a sub-fellowship if you want. And then you will be an interventional cardiologist, but you've gone through the training of internal medicine, the cardiology fellowship, and after the cardiology fellowship, then you got to go through another fellowship to become an interventional cardiologist. There's some specialties like that where getting one fellowship is not enough if you want to become more specialized. You got to do more in order to get more. And in addition to that, there's some other specialties where you finish going through all of that, but all of the fellowship and the residency, and then you could do what is called a certificate course. Sometimes you could do a course that may last sometimes several hours, maybe a day or two, or it could last several weeks, or in some cases maybe, well, several weeks or maybe a few months. You could do a certificate course in an area that is not necessarily covered in any detail in residency. You probably were introduced to it, but now for you to learn more and become more proficient in that area, you have to actually spend more time learning about that area of specialization, which is also makes you, you could call yourself somewhat a more trained doctor in a specialized area. So you're learning less and less in an area that is, so when you become as specialized as you are, then you're learning less and less in an area that is smaller and smaller, but then you are the expert in that area. And that can be very beneficial in a lot of ways, depending on the specialty you're in and how much you want to do that. So the general takeaway from this is that as a physician, you have the option of determining at what point or how much training you want to do as a physician or as a medical doctor, and then you could go from there. And that could be the point at which you want to become more trained in areas that other doctors are not training. So you are then the expert in those areas, and those could be very important in advancing your career in a direction which is not possible without those additional training. So the summary of path that you need to go through to become a fully trained doctor. And as you can see, there are a number of years that are spent, but let that not prevent you from wanting to become a doctor, because at the end of the day, whatever you do, you're still going to get older, time is still going to pass, and whether you do it or not, whether you do something or not do something, you're still going to gain those extra years and become older one way or another. Now, so you're finished your medical training and you're out there and you're working and you're having a wonderful life. But what if you didn't get to medical school? Now, there's still other people that are called doctors, and if the title is important to you, or even if it's not important to you, there are other careers that you could do where you are a doctor that are just as important or sometimes even more important than what a medical doctor does. So let's talk about some of those other medical service providers that are also a very important part of what we are accustomed to in our society today. For example, there is a dental surgery, doctor of dental surgery, or doctor of dental medicine. Of course, we all know what a dentist does. Dentists are very important in our life and in our world. So being a dentist is an option for some people. Also, there's doctor of podiatric medicine, or they're called podiatrists. And what a podiatrist does is that he or she works primarily on feet. So ailments of the feet, medical condition of the feet that need to be fixed or surgically repaired or treated, podiatrists would work on the feet. So they are also doctors. And then there's another type of doctors that are very important in our society, optometry, doctor of optometry. And what an optometrist does, they're called optometrists. Well, they basically treat ailments of the eyes. And they also, for example, they will also make sure that the prescription that you're wearing for your eyeglasses or your contact lens, that they're appropriately suited for you. They'll measure your eyes and make sure that whatever lens you're wearing, that will be the appropriate lens for the type of condition that you have. Say, for example, you're short-sighted or you're far-sighted, or whatever the condition of your eye, they will do the measurement for it. Now, optometrists are different from ophthalmologists, which should not be confused. And ophthalmologists are trained medical doctors, whereas optometrist is trained in the specialty of optometry as described, as I just described. Now, in addition to being all of those, you could also, if you're so inclined, you could be a doctor of veterinary medicine, where if you love animals, you could be a doctor of veterinary medicine, DVM. So doctor of podiatry, DPM, doctor of podiatric medicine, and then doctor of optometry, OD, which is different from DO, doctor of osteopathic medicine. Now, those doctors that I just mentioned, they can all write prescription for medication. That is just like the medical doctor, the MD, the MB, BS, the DO, all can write medical prescription. So is the optometrist, the dentist, as well as the podiatrist. They could write medical prescription. But there are a number of other doctors that generally do not write prescription. But there are also doctors. Let's talk about some of those doctors. Now, these doctors in generally earn what is called a Ph.D. Doctor of Philosophy. And Doctor of Philosophy can be awarded in almost any discipline. For example, it could be chemistry, psychology, clinical counseling. Like here you see Dr. Maxine Foster, graduate of Martin Bay High School, who is a clinical counseling, a Ph.D. in clinical counseling. So having a Ph.D. allows you to be an expert in the field of your chosen desire. So whether that be chemistry, biology, physical therapy, you could have a PhD in physical therapy. Now, almost any discipline you could have a PhD in. And having a PhD allows you to be an expert in that. You could use that as a teaching degree, you could become a faculty member, or you could become a major player in some industry. Let's say you have a PhD in food science, for example. You could become a major player in the food industry. But these are additional careers that could be looked at as well. Now, other doctors, I mentioned Doctor of Physical Therapy. Now, there used to be a time when if you have a physical therapy degree, you'd have a bachelor's or a master's degree. Now, everyone is having what is called a Doctor of Physical Therapy degree. That is DPT. And now that allows you to be a physical therapist, and where you are now Dr. So-and-so physical therapist. So that is another option as well. And then another option is Chiropractic Care, or Doctor of Chiropractic Medicine. So a chiropractor are doctors that generally works in manipulation of the spine, as well as they do other things other than that. And the purpose of the manipulation of the spine and adjustment of the spine is for pain control. And they can do various manipulation that helps the patient to relieve symptoms. But as I said, that's not all they do. Just like in any of these, as I said, Doctor of Physical Therapists, the breadth and range of all of these specialties, all of these disciplines are extensive. So you could go and learn about these different specialties or these different areas of discipline that are doctors as well. Now, one that is also referred to as doctor, but is generally not part of the medical profession, but I'll just mention it anyway. JD, Juris Doctor. A Juris Doctor is really a law degree, a professional law degree. So if you're interested in being an attorney, attorneys and doctors make good friends and good companies. So being a doctor, you are essentially a doctor of the law, Juris Doctor. So there's a range of option in terms of being a doctor, medical doctor, non-medical doctor, professional degrees. So the choices are out there. So you don't necessarily have to be a medical doctor to be called a doctor. As by now, I'm sure everyone knows that. But there are options, other options, that you could have very, very successful career. And a lot of times, sometimes much more successful than medical doctors. Not every medical doctor is successful. Sometimes in life, what you do is so much dependent on you as a person rather than the profession that you're in. So that's something that for all those of you who are aspiring to be whatever you want to be, as long as you do it well, you have a chance of being among the best in your given area. And at the end of the day, we're all trying to make a living, and we're all trying to make a life to support ourselves, our family, and be a good member of society. So what we do, what we strive for sometimes is not that important as the idea that we do it well and make the best of it. And once we do that, we're on our way to having a successful life. So what can you do after you're finished, you got your doctor's degree and you're out there, you're practicing? What can you do after that? Is that it? You got your medical doctor's degree or whatever doctor degree you have. What can you do? Well, you could lecture. That's one thing you could do. Or you could become a speaker. You could write scientific articles. You could become an author of books. And when you do that, that would be something that would be of benefit to humanity as well. You could become a talk show host. You could become a radio personality. You could do that as well. You could go into business. You could go into business and be an entrepreneur and develop whatever you want to, so it doesn't stop at being a doctor. And then when you do all of these, then you got to remember that sometimes it is said that to whom much is given, much is required, to whom much is given, much is required. So you want to also think about helping others, helping other people in your community, in your school. So I always say to people, it's good to go back to your school. Go back to where you learn and do what you can to help. You don't have to be a doctor to do this, of course. You could be in any profession. It's important that you do that. So I say go back there and try to help, try to encourage, try to be a part of things like career day and whatever function is going on. Try to be a part of those things. Those are important things. And sometimes you never know who you run into. You run into some people that are important. But that's not the important thing. The important thing is being a part of helping others and giving back. So you could end up forming a foundation as a doctor. That's something that a lot of doctors, that's something that many doctors have done. And of course you don't have to be a doctor to form a foundation either, but that's one way of giving back to the community, giving back to others. And it's an important part of our growth and development, and helping others, which is something that most doctors or a lot of doctors are people who are genuinely most doctors generally care about others in general and tend to want to help others. So it's not surprising that doctor will do that. And when it's all said and done, you will find that when you're doing all of these things, you will need other people involvement. You will need your staff. You will need people, because the more successful they are, the larger your staff is, and the more people you have involved in your life, because that's just a part of nature. You cannot do it alone. If you just want to just make enough for yourself and eat and feed your family, then yeah, you could probably do it alone. But if you're trying to do more than that, you will need to involve others, and you also have to know that they are in part the reason why you're successful, and therefore it's important to appreciate them. We cannot do it alone. Doesn't matter how successful you are or where you go. There's somebody there who have made a contribution. Even if you're paying them, they're making a contribution. And if you have a great staff, the better your staff is, the better the people you have around you, the more successful you're gonna be in the long run. I want to end by saying, again, when you work to achieve, and do the very best you can. Always do the very best you can. Because once you do the very best you can, you will always have a chance of having many options. So you're in school now, you're trying to figure it out. Don't worry about that. Do the best you can, give it your best, because at the end of the day, you will have lots of choices. And if you have lots of choices, then you could make better decisions. So do it well, work to achieve, and you'll have opportunities that will prevent themselves time and time again, and you'll be able to seize those moments. And from one of my schools, work to achieve, the other is carpe diem, seize the moment. So you seize those moments that are presented to you, and you will be successful. I truly hope that this video will be of benefit to others. So share this videos with others, comment on it. It's on YouTube channel, so subscribe if you visit the channel, and it will be there for as long as there's YouTube. I won't take it down, it will still be there. So I hope it will be of benefit to each and every one of you. My information is there. If anyone wishes to contact me, it is there. So feel free to share it. And I hope this in general will be something that you will find something in this video that will help you on your path or someone that you know on their path to success. I want you to take care of yourself, and thank you so much for listening and being a part of this presentation. I appreciate you. Thank you so much, and take care of yourself, everyone.